a good evening, everyone. I want to start by addressing something that's often dismissed as a normal part of aging, but shouldn't be. The first of those be, if you're a senior or you care for one, you probably know how disruptive nighttime urination can be. You fall asleep only to wake up, sometimes multiple times, to rush to the bathroom. This isn't just annoying. It's a health risk. Those would be sleep fragmentation affects everything from memory to insulin sensitivity to cardiovascular function. So tonight, I want to share something surprising, how targeted nutrition, specifically vegetables, can support better bladder function and reduce those nighttime interruptions. Let's start with the basics. Nocturia, waking at night to urinate, can have multiple causes: decreased bladder capacity, overactive bladder, excess nighttime urine production, and of course, the prostate issues in men. But across all these causes, there are some common inflammatory and hormonal pathways at play. And that's where nutrition, especially specific vegetables, can help. Let's take a moment to reframe something often overlooked in both clinical settings and casual conversations. The bladder is not an isolated organ. It's not simply a passive reservoir that empties when full. Its function, particularly in older adults, is deeply intertwined with hormonal regulation, systemic inflammation, prostate health in men, and even circadian rhythm. The first of those would be, so when an older patient comes in reporting that they're waking up 2 or 3 times a night to urinate, I don't just think about the bladder. I think upstream and downstream. That brings us to an unlikely yet remarkably potent intervention: pumpkin seeds. At first glance, it sounds too simplistic to be worth considering. How could something as common as a snack food play any meaningful role in addressing nocturia? The first would be, which can have multifactorial roots, ranging from detrusor overactivity to benign prostatic hyperplasia, BPH, to nighttime polyuria due to dysregulated vasopressin secretion. But pumpkin seeds, and to a lesser extent, pumpkin flesh, offer a compelling combination of bioactive compounds that some give the exact mechanisms driving nocturia. Let's unpack this. First, the first of those would be the role of phytosterols. These are naturally occurring steroid compounds found in plant cell membranes, and pumpkin seeds are unusually rich in them, particularly beta-cytosterol. Several studies have evaluated the effect of phytosterols on prostate volume and urinary symptoms in men with BPH. A landmark double-blind, placebo-controlled study published in the British Journal of Urology International found that beta-cytosterol supplementation significantly improved urinary flow rates and reduced post-void residual volume in men over 50. Now, here's the interesting part: the mechanism mirrors that of some pharmaceutical agents. Beta-cytosterol appears to inhibit the enzyme 5-alpha reductase, which converts testosterone into dihydrotestosterone DHT, a more potent androgen that drives prostate tissue growth. This is precisely the same enzyme targeted by finasteride and dutasteride medications commonly prescribed to men with BPH. However, unlike these drugs, pumpkin seeds don't come with side effects like sexual dysfunction or gynecomastia. In men, reducing prostate inflammation and slowing its growth can directly translate to better urinary flow, reduced residual volume, and fewer nighttime awakenings to void. But even in women who obviously don't have prostates, the anti-inflammatory effects of these compounds may help modulate bladder function. The first of those would be, particularly if the root issue involves overactive bladder or interstitial cystides. Second, we need to consider zinking. Pumpkin seeds are among the richest plant-based sources of zinc, a trace mineral involved in over 300 enzymatic reactions in the body. First of those would be, including those related to immune function and hormone balance. In men, zinc levels in the prostate are naturally high. First of those would be, and deficiency has been correlated with increased risk of prostate enlargement and inflammation. Supplementation with zinc, either through food or low-dose capsules, has shown potential to reduce prostate volume in small pilot studies. But zinc's role doesn't stop at the prostate. It also regulates tight junctions in epithelial tissue, which includes the bladder lining. This matters because increased bladder permeability, or what some researchers are beginning to call leaky bladder syndrome, akin to leaky gut, can sensitize the detrusor muscle and increase urgency. Zinc may help strengthen the bladder's mucosal barrier and reduce irritative symptoms. Third, magnesium. Most people are walking around magnesium deficient, and pumpkin seeds are an excellent source. From a urological perspective, magnesium helps modulate smooth muscle tone, including in the detrusor muscle of the bladder wall. Magnesium deficiency can contribute to excessive contractility, i.e. bladder spasms, particularly at night when parasympathetic tone is dominant. The first those would be, and if you think magnesium doesn't matter in this context, consider this. The several small trials have found that magnesium supplementation can reduce symptoms of overactive bladder, especially urgency and frequency at night. The first of those would be. So now we have a trifecta of bioactive moles: phytosterols, zinc, B, and magnesium, each working through different yet complementary pathways to reduce the physiological drivers of nocturia. Then there's the tryptophan content. Pumpkin seeds are relatively high in this amino acid, which serves as a precursor to serotonin and melatonin. While tryptophan alone won't cure nocturia, its presence could support better sleep architecture, helping individuals return to sleep more easily if they do wake up at night. In that sense, pumpkin seeds may not just help nighttime urination itself, but also mitigate the downstream consequences of disrupted sleep. Now, let's address the common concern B. How much do I need to eat, and will this really replace medication? First, dosage. Most of the studies have shown benefit used about 5,000, 1,000 ml of pumpkin seed extract per day. That roughly translates to 12 tablespoons of roasted pumpkin seeds, or pepitas, daily. Importantly, the first of those would be you want them unsalted and ideally soaked, or to reduce phytic content, which can inhibit mineral absorption. Incorporating pumpkin seeds doesn't require an overhaul of your diet. You can add them to salads, yogurt, or oatmeal. Some people blend them into smoothies. A consistent daily intake over 4 to 8 weeks is typically needed before subjective improvements are noticed. Now, to manage expectations, this is not a replacement for alpha blocker 5-alpha reductase inhibitors in men with advanced BPH, nor will it override an unstable bladder with severe neurologic dysfunction. But it may be sufficient for people with mild to moderate symptoms, and it's certainly a foundational adjunct for anyone looking to reduce medication load or improve long-term urinary health. Lastly, a brief word on pumpkin flesh. Those would be which often gets less attention. While it lacks the dense concentration of sterols found in the seeds, it's rich in carotenoids, especially beta-carotene and lutein. The first of those would be, these are potent antioxidants with anti-inflammatory properties that may support the health of the bladder wall and detrusor muscle. The first of those would be, there's also emerging evidence that oxidative stress plays a role in the progression of overactive bladder syndrome, especially in older adults. So incorporating pumpkin flesh, whether roasted, pureed in soup, or baked into low glycemic dishes, adds another layer of benefit. The first would be, what we're looking at here is a food-based systems level intervention. One that doesn't just address the symptom, waking up at night, but also tackles some of the upstream pathophysiology. And it's safe, inexpensive, and easily implemented. B, in the context of aging, particularly for those focused on extending not just lifespan, but health span, we should be paying more attention to these subtle, unglamorous symptoms. Nocturia isn't just a sleep problem. It's a fall risk. It's a driver of cognitive decline. It's an early signal of endocrine disruption, the cardiovascular stress, or prostatic inflammation. When patients get up at night to urinate, they often don't just lose sleep. They lose resilience. And when a handful of pumpkin seeds might help reverse that downward spiral, it's worth place on the short list of evidence-based nutritional interventions. When we think about food as medicine, the conversation often gravitates toward polyphenol-rich berries, omega-3 laden fish, or sulfur-rich cruciferous vegetables. The first of those would be asparagus. Rarely makes that list. It's been relegated to the category of side dish or dietary afterthought. Largely appreciated, if at all, for those would be for its fiber content or maybe its vitamin K. But this underestimation is unfortunate. The first of those would be particularly for older adults grappling with one of the most disruptive and under-discussed symptoms of aging, nocturia, or frequent nighttime urination. Nocturia is not just sleep issue. It has cascading consequences: sleep fragmentation, impaired glymphatic clearance in the brain, elevated nighttime cortisol, and reduced insulin sensitivity the next day. For older adults, it also increases the risk of falls, fractures, and cognitive impairment. And the solution is not always pharmacologic. Some of the most meaningful interventions lie at the intersection of circadian rhythm, renal physiology, and diet. Asparagus sits uniquely at that intersection. Let's begin with what asparagus does to the kidney. Known historically as a natural diuretic, asparagus contains a compound called asparagine, an amino acid that influences renal tubular function. Specifically, it enhances the rate of glomerular filtration and sodium excretion. In simpler terms, it nudges the kidneys to eliminate excess fluid more efficiently. While this sounds counterintuitive, why we want a diuretic in someone who's already urinating at night? Timing is everything. When asparagus is consumed early in the day, typically at lunch, its mild diuretic helps offload extracellular fluid and sodium during daylight hours. This is especially relevant for older adults who often exhibit impaired diurnal variation in urine production. Ideally, human first of those would be humans should excrete most of their fluid volume during the day, not at night. But aging kidneys, the first of those would be combined with reduced responsiveness to vasopressin, the antidiuretic hormone, often flip this script. The result is a higher proportion of nocturnal urine output, termed nocturnal polyuria. Strategically introducing asparagus at midday helps restore that diurnal rhythm by enhancing daytime natriuresis, the excretion of sodium in the urine, thereby reducing the osmotic load that the kidneys must handle overnight. First of those would be this simple timing intervention supported by dietary leverage can reduce nighttime urine volume and potentially the frequency of awakenings. The first of those would be, but asparagus isn't just a diuretic, it's an anti-inflammatory agent. It contains saponins, particularly asparagoside. The first of those would be which have demonstrated anti-inflammatory effects in both in vitro and in vivo studies. Inflammation plays a pivotal role in detrusor overactivity and bladder hypersensitivity, two major contributors to nighttime urgency and frequency. If the bladder wall is inflamed, even small volumes can trigger the urge to void. Reducing that inflammation may increase functional bladder capacity and delay the urgency signal. Additionally, asparagus is rich in glutathione, would be one of the body's most powerful endogenous oxidants. Glutathione levels decline with age, and that's particularly problematic in organs with high metabolic activity like the bladder and kidneys. By providing dietary precursors, as would be, asparagus may support glutathione synthesis and reduce oxidative stress in the urothelium, the bladder lining, which is increasingly implicated in like overactive bladder, OAB, and interstitial cystides. In terms of gut microbiota, asparagus also offers a prebiotic advantage. It contains inulin, a fermentable fiber that supports the growth of beneficial gut bacteria such as Bifidobacterium and Lactobacillus. You may ask, what does the gut have to do with urination? More than you'd think. Emerging research suggests a gut-bladder axis, similar to the well-studied gut-brain axis. Certain gut microbes influence systemic inflammation, estrogen metabolism in postmenopausal women, and immune signaling that can alter bladder sensitivity. The first would be improving gut microbial diversity. Wettic fibers like inulin may indirectly modulate or function through these systemic channels. Additionally, the first of those would be some bacterial metabolites, such as chain fatty acids, have been shown to exert neuromodulatory effects on visceral organs. First of those would be potentially influencing bladder contractility and urgency. One often cited objection to Argus consumption is the distinctive sulfurous odor in the urine that follows. The first of those would be, this is due to the metabolism of asparagusic acid into volatile sulfur compounds. While some individuals lack the genes to smell these compounds, the first of those would be, others find the smell off-putting and avoid asparagus as a result. This is unfortunate because the first as would be, when people think about parsley, they often picture it as a garnish, an afterthought added to the edge of a dinner plate. But as anyone interested in the intersection of micronutrient density, phytochemistry, and age-related decline knows that small green herb is far more than decorative. The first of those would be, it's pharmacologic. And when we zoom in on the burden of nighttime urination, one of the most disruptive, underestimated challenges facing older adults. Parsley has an unexpectedly strong case for therapeutic relevance. To understand why, we need to revisit the biology of Nocturia. In aging individuals, the bladder becomes more reactive, less elastic, and often more inflamed. The first of those would be, it doesn't hold urine as efficiently, and the neural signals that control urge and release become dysregulated. Meanwhile, renal circadian rhythms become blunted, often leading to increased nighttime urine production. For men, prostate enlargement adds mechanical resistance. For women, those would be postmenopausal hormonal shifts, alter pelvic support, and bladder positioning. Across all these mechanisms, one theme keeps reappearing, be inflammation and smooth muscle dysfunction. And that's where parsley steps in. One of parsley's key bioactive compounds is apigenin, a flavonoid with significant antioxidant and anti-inflammatory properties. Apigenin has been studied for its effects on cancer, cognition, and cardiovascular health. Those would be. But what's particularly interesting in the Nocturia is its spasmolytic activity, its ability to reduce unwanted smooth muscle contractions. The bladder wall is lined with detrusor muscle, which contracts to expel urine. In conditions like overactive bladder, OB, which disproportionately affects older adults, the first of those would be the detrusor contracts prematurely, even when the bladder isn't full, resulting in urgency, frequency, and nocturnal voiding. Would be, apigenin has been shown in both animal and cellular studies to calm smooth muscle activity, particularly in the gastrointestinal and urinary tracts. From a mechanistic standpoint, apigenin appears to exert its effects by modulating intracellular calcium channels and nitric oxide signaling, two major regulators of muscle tone in visceral organs. In the detrusor muscle, this may mean fewer inappropriate contractions and greater bladder capacity at night. That in turn leads to less frequent awakenings to void. Parsley, those would be, also acts as a mild diuretic, which again might sound counterproductive. But when taken earlier in the day, ideally with lunch, it encourages earlier fluid excretion, offloading water and sodium while the body is still in an upright, active posture. This shifts renal workload toward the daytime and away from the vulnerable nocturnal window when the kidneys become less efficient and vasopressin. Antidiuretic hormone signaling weakens. The effect is a circadian redistribution of fluid. The first of those would be, not unlike what we aim for when recommending midday sodium restriction or compression stockings in patients with dependent edema. Another layer of parsley's benefit lies in its phytoestrogenic compounds, particularly relevant for postmenopausal women. The first of would be the drop in estrogen that occurs after menopause is associated with changes in collagen structure, reduced mucosal integrity in the bladder and urethra, and decreased pelvic floor muscle tone. all of which contribute to urinary symptoms. The first of those would be parsley contains plant-based compounds that weakly mimic estrogen and may support tissue repair and urogenital health. Would be, while parsley isn't a substitute for hormone replacement therapy and shouldn't be treated as one, it's a low-risk, food-based tool that supports tissue health along similar pathways. From a micronutrient perspective, parsley is extraordinarily dense. Just a quarter cup provides high amounts of vitamin C, vitamin K, beta-carotene, folate, and trace minerals like potassium and magnesium. These nutrients support cellular hydration, muscle function, and neurochemical signaling. Of particular interest is magnesium. As we age, magnesium intake tends to drop, and absorption efficiency declines. Magnesium plays a critical role in neuromuscular relaxation. And deficiency is linked to increased muscle excitability, including in the bladder. Some studies have shown that oral magnesium can help reduce symptoms of overactive bladder and nighttime urination, particularly in women. Parsley's contribution to magnesium intake may not be enormous in isolation, but in the context of a whole food diet, it helps close the gap, and does so in a bioavailable. The first of those would be food matrix form, which typically improves absorption. We also have to consider parsley's effect on the gut-urinary axis, a relatively underexplored area, but one gaining attention. Parsley is rich in chlorophyll and volatile oils, which exhibit antimicrobial activity. One of the emerging hypotheses in chronic bladder dysfunction, especially interstitial cystides and refractory OB, is low-grade bladder microbiome dysbiosis, a subtle but chronic imbalance in uropathogens or subclinical inflammation. While most of the data here are preliminary, dietary components that reduce bacterial load and support healthy mucosal immunity may offer long-term protective effects. Parsley, with its antimicrobial, anti-inflammatory phytochemistry, may be one such agent. Of course, one might ask, is there any clinical data to back this up? The first of those while large randomized controlled trials on parsley for Nocturia are scarce. Unsurprisingly, given its status as a food rather than a drug, traditional medicine systems like Ayurveda and Urinary have used parsley, often in the form of tea or decoctions, for urinary complaints for centuries. A few small clinical trials have explored its use in treating mild urinary tract symptoms, showing promising results in reducing frequency and urgency, particularly in older adults. One notable Iranian study found that parsley seed extract reduced urinary frequency and improved bladder comfort in patients with mild bladder dysfunction over a 6-week period. While the sample size was small and the trial lacked blinding, the findings were consistent with parsley's known pharmacologic effects. So how do we apply this in real life? From a practical standpoint, parsley tea is one of the most effective delivery formats for urinary purposes. The first of those would be steeping 2 tablespoons of fresh chopped parsley or 1 tablespoon dried in hot water for 10 minutes creates a gentle, aromatic tea that can be consumed in the late morning or early afternoon. Alternatively, incorporating a handful of parsley into a salad, soup, or smoothie can provide a more sustained dietary source. As with most botanical interventions, consistency matters. Benefits tend to accumulate over 3.6 weeks of regular intake. Importantly, parsley is safe for most people when used in culinary doses. However, individuals on blood thinners due to its high vitamin K content or those with kidney stones, oxalate sensitivity should speak with a physician before significantly increasing intake. The first of those that said, for the vast majority of older adults, parsley is a low risk. The first of those would be nutrient-dense intervention that aligns with broader goals of reducing pharmacologic burden while improving urinary control, especially at night. We often look to high-tech solutions for complex problems, but sometimes a simple, overlooked herb, rich in flavonoids, magnesium, and muscle-calming compounds can play a meaningful role in a systems-based strategy for health span. The first of those would be, when you start to think of parsley not as a garnish but as a tool, a modulator of inflammation, a smooth muscle relaxant. Those would be a diuretic time to your circadian biology. It starts to look less like a leafy accessory and more like a targeted intervention for one of the most frustrating. The first of those would be quality of life eroding symptoms of aging, nocturia. And as with all interventions that carry little risk and have plausible mechanistic benefit, first of those would be parsley deserves more than the corner of your plate. It might just belong in your daily routine. It's easy, especially in the echo chamber of longevity podcasts and academic journals, to let data eclipse lived experience. Yet when I sit with patients in the clinic, the conversation rarely starts with p-values and hazard ratios. It starts with a feeling exhaustion from nights punctuated by bathroom trips, a creeping fear of falling in the dark, embarrassment about asking a travel companion for the aisle seat, just in case. So before we close, let's remember why we're talking about pumpkin seeds, asparagus, and parsley in the first place. The goal isn't to win a trivia contest on phytosterols or apigenin. It's to reclaim something profoundly human, unbroken sleep. Because restorative sleep is not a luxury tacked onto health span. It is the substrate on which virtually every physiologic repair process is laid down. Deep wave consolidation of memory, growth hormone pulses that preserve lean mass, nocturnal dips in sympathetic tone that spare the endothelium from relentless stress, fragment that architecture enough nights in a row, and the body, like any overworked system, begins to misfire, executive function slips, insulin resistance creeps, even telomere attrition accelerates. Now layer on the psychosocial reality. A senior who wakes up 3 times nightly is exposed to nearly triple the fall risk of a counterpart who sleeps through a one hip fracture can erase decades of dutiful exercise and pristine lipid panels. And the fear of not making it in time has a curious way of shrinking a person's world. First declining evening invitations, then road trips, then even afternoon outings that might delay dinner and bump fluid intake later into the circadian cycle. Social contraction follows, and with it, cognitive decline and depression. That's the iceberg below the waterline, which is why a handful of pumpkin seeds at 4 p.m. or a lunchtime spear of asparagus isn't trivial. It's a lever. A small but mighty nudge that tilts the physiology back toward equilibrium without the side effect baggage that often comes with anticholinergic bladder meds or 5-alpha reductase inhibitors. It's also actionable, something you can integrate tomorrow without a prescription pad, prior authorization, or 3-hour wait at the pharmacy. But let's be realistic. Nutrition interventions rarely behave like light switches. They're more like dimmer knobs. Turn consistently, they brighten the room over weeks, not minutes. That calls for patience and for a mindset shift from quick fix to iterative experiment. In practice, I ask patients to run a 4-week N of 1 trial. For men, we'll layer 2 tablespoons of unsalted pumpkin seeds at mid-afternoon, asparagus at lunch 3 to 4 times weekly, and a small cup of parsley tea no later than 3 p.m. We pair that with a bladder diary, times, volumes, awakenings to provide objective feedback. If night time voids drop from 3 to 1, that's a clinically meaningful win, even if we haven't reached perfection. And if the needle doesn't move, we reassess. Was timing off? Has sodium intake crept up at dinner? Are beta blockers blunting renin-angiotensin signals? Precision means iterating, not blaming the intervention. Some ask, why not just prescribe tamsulosin or oxybutinin and be done with it? Sometimes we do. I'm not anti-pharma, I'm anti-unexamined default. Every drug is a trade-off: dizziness, dry mouth, cognitive dulling. For the 78-year-old already juggling 5 medications, another pill, even a safe one, has ripple effects on adherence and drug-drug interaction. If we can offload even part of the symptom burden through food that confers parallel wins in micronutrient density, gut microbiome diversity, and metabolic flexibility. That's an asymmetric bet in favor of health span. Let's also speak to agency. Seniors are often handed protocols rather than choices, which can feel infantilizing. Saying, here are 3 vegetables, here's how and when to use them, and here's the metric we'll track together, invites partnership. It converts the patient from passenger to co-pilot. And in my experience, behavior change rooted in agency outlasts any white coat mandate. A word on compassion. If you're listening and thinking, I've tried everything and I'm still up 5 times a night, I hear you. Physiology is messy, and sometimes pumpkin seeds aren't enough. Maybe your kidneys no longer respond to vasopressin, or your prostate has advanced beyond lifestyle leverage. In those cases, pharmacology or surgery may be the right next step. The vegetables aren't a moral test, they're a tool. Failure of the tool isn't failure of the person. Yet for many, these simple inputs are the difference between a broken night and a contiguous 7-hour stretch of sleep, the biological equivalent of compound interest. One night of complete rest improves glucose tolerance the very next morning. A week lowers inflammatory cytokines. A month recalibrates leptin and ghrelin, subtly curbing the late-night snacking spiral that sabotages weight management. Better sleep begets better choices, and a virtuous cycle is born. So as you leave tonight, think of tomorrow's grocery list not as a chore, but as protocol design. Pick up raw, unsalted pumpkin seeds, aim for a 1/4 cup. Grab a bunch of asparagus, fresh or even frozen, that you'll steam or roast for lunch. Snag a fistful of flat leaf parsley, chop it, steep it, taste the earthiness, and know you're nudging biochemistry in your favor. It's mundane, yes, but so is brushing your teeth, and you wouldn't skip that because the benefit isn't cinematic. Health span is earned in hundreds of unglamorous reps. Finally, track the data. Even if it's just pencil marks on a bedside notepad, 1 p.m., fell asleep, 2 a.m., woke to void, 5 a.m., woke again. Over time, the numbers tell a story more honest than memory, and if the trend bends downward, 3 awakenings to 2, 2 to 1, celebrate it. Micro progress is the only kind that endures. I'll close with a reminder from the Stoics: we suffer more in imagination than in reality. The fear of nighttime urgency often exceeds the hazard itself. By experimenting with low-risk, nutrient-dense foods, you armed yourself with data instead of dread. Whether tonight brings a full 7-hour stretch or still demands a 3 a.m. pit stop, you're now equipped with a plan rooted in physiology, not folklore. That is agency. That is progress. And progress, stacked patiently, becomes transformation. Thank you for your attention, for your willingness to treat the mundane as meaningful, and for recognizing that better sleep through smarter nutrition isn't a fringe biohack. It's fundamental care for the organism you inhabit. Sleep well, and may your nights be quiet